A calcaneus stress fracture is a common cause of heel pain affecting older athletes and active people. In this video, I explain what the injury is, why it happens, and what treatment options are available. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. Now, the calcaneus is the heel bone itself. If you look at this model, it's this large bone here. You can feel the tuberosity where your Achilles tendon, if it was on this model, would attach down here. But that big bone down there is your heel bone or your calcaneus. Now, a stress fracture, as I've talked about in a lot of videos on this channel, whatever bone it is an overuse injury, meaning that bone gradually fails over time, sort of microscopic stress. Sometimes I'll use the analogy of when you basically open up a paper clip and bend it back and forth and it gradually gets weaker and weaker. That's what happens with the calcaneus. Now, this is typically not an injury in younger people. Teenagers, young adults, even middle-aged adults. It typically doesn't start happening until people are in their 50s and 60s. And the reason for that is that it typically occurs only when you start to develop some bone loss, and the calcaneus, the heel bone, would be one of the common places that happens. So it's typically older people, but it also requires that overuse. That's why you'll see it a lot in women in their, say, 50s and 60s who are runners that are putting a lot of stress on that bone, but that bone doesn't heal as normally as possible. Now, fortunately, it is not an injury that needs surgery. It heals on its own because, again, the bone's not out of place. It's a stress fracture, but you do have to get that to heal. Now, diagnosis typically can be made by physical exam. You can basically just squeeze the sides of that bone together, and if it causes a lot of pain, again, in that right patient population, that would suggest it. But if there's any question, an MRI can show you the calcaneus stress fracture, even if the x-rays look fine. Doesn't typically need surgery because that bone lines up well, but you have to get it to heal. Usually people do that, orthopedic surgeons do that by placing the patient in a boot. You don't typically need a cast because then the ankle gets really stiff, but a boot that you can take off to sleep and shower, but you wear when you're bearing weight would typically be enough. The boot is as much as anything so that you could put a little bit of pressure on it. I, for one, don't typically have somebody be strictly non-weight bearing unless the pain is so bad that the weight bearing just isn't possible. But usually for most people with this injury, you can put some weight on it in the boot and then gradually over maybe 3 weeks or at the most 6 weeks, that bone heals. You get them out of the boot, you let somebody get back to daily activities and then slowly work their way back into jogging or whatever it is they want to do. Very, very successful as far as healing rates with that. It can take some time, but as far as injuries go, it's not one of the more significant ones. I'd love to hear your experience with your foot injury, especially if you've got a stress fracture. So leave those in the comments below. Just understand, if you leave basically a request for medical advice as a question in the comments, I can't offer you medical advice. So what I do is I address that topic in a future video. Make sure to subscribe to my channel, click the bell to be notified when I release a new video or when I start another live stream, including my Ask Dr. Geier live shows. Thank you for watching. I look forward to helping you feel, look, and perform better than ever.